Welcome, welcome, welcome to tonight's conversation, our webinar Wednesday, our third of this Celiac Awareness Month. Tonight, we're going to be discussing, is there a connection between IBS and celiac disease? So before we get started, I'd like to take a moment for a land acknowledgement that this presentation was created on the traditional and unceded territory of the Coast Salish people, including the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And here we promise to learn, live, and share educational opportunities in this traditional territory, and we share our deepest gratitude. So our speakers this evening. So my name is Nicole Byrom. I'm a registered dietitian with Celiac Canada. And tonight I'm joined with registered dietitian Nishaat Patel, who is a registered dietitian with Nutriprocan Canada Dietitians. And she also does a little bit of, she volunteers or works with the Canadian Digestive Health Foundation, which is who she's representing on the call here tonight. So a little bit of housekeeping. For this evening. Please submit any formal questions that you'd like to be asked to either myself or Nishaat into the Q&A box. So along the bottom or along the top, you'll see a toolbar that has Q&A. Please put those questions. That's where we will be taking a look at the end of the presentation to answer the questions. The chat will be more for informal conversation. Please keep it respectful and polite. We will not be gathering questions from the chat, so please do ensure that that goes into the Q&A. We are recording this evening, and you will be receiving a follow-up email with the recording in your inbox in the next few days to ensure that you've got the recording, and any follow-up information that we deem it will be helpful will also be included in that email. The objectives of tonight are to discuss what irritable bowel syndrome is, what are signs and symptoms, testing and diagnosis, and treatment options for IBS. We're also going to discuss the way that IBS and celiac disease overlap and ways to get tested for celiac disease, what diagnosis looks like, what typical and atypical symptoms are. So we're going to have a lively conversation. Remember to write those questions in the chat and that they will be asked at the very end. So I'm going to pass the mic over to Nishaat, and she's going to chat about irritable bowel syndrome.
Thanks so much, Nicole. So just a little bit of background and kind of introduction on irritable bowel syndrome, or IBS. Could we move on to the next slide, please, Nicole? Thank you so much. So IBS is a functional gut disorder. It's often associated with gut dysmotility, brain gut dysfunction, and visceral hypersensitivity. So while there's no clear consensus on the exact causes of IBS, we do know that it is associated with the gut being super sensitive. Altered gut motility can be associated with bacteria or infections, as well as genetics. So these are just some of the associations that we know of. Next slide, please. Great. So signs and symptoms of IBS. So they can vary. They can be a combination of all of these or a couple of these, but often we see abdominal pain and cramping, often alleviated by bowel movements. The pain can be sharp, stabbing, dull, crampy. Bloating and distension is a big symptom of IBS, as well as gas, flatulence, often a change in bowel habits, so either diarrhea, constipation, both, or the feeling of straining or incomplete evacuation of stool, mucus in the stool, fatigue, and often associated with stress, depression, and anxiety as well. Next slide, please. Thank you. So diagnosis and testing of IBS. So there's no one specific test to diagnose IBS, despite what, you may see some things advertised online, but there's no one specific test to diagnose it. It's often a combination of tests, such as blood tests, stool tests, scopes like colonoscopies and gastroscopies. Unreliable tests are those IgG food intolerance tests, breath testing, and fecal microbiota testing. We also need to exclude other conditions when diagnosing with IBS. So celiac disease is a big one, infections, irritable bowel disease, such as Crohn's or colitis, investigating if there's any gallbladder disease, diverticular disease, issues with the thyroid, so on and so forth. And also the investigation of red flags is really important in testing for IBS. So anemia, blood in the stool, unintentional weight loss, fever, daily diarrhea or nocturnal diarrhea, and family history of bowel disease. And in terms of diagnosing IBS, the most used criteria is the Rome 4 criteria. So abdominal pain at least 1 day per week in the last 3 months, associated with 2 or more of the following. 1, related to defecation, 2, associated with a change in the frequency of stool, and 3, associated with a change in the form or the appearance of the stool. And then finally, classifying the IBS into different subtypes. So IBS-C is constipation dominant, IBS-D is diarrhea dominant, IBS-M or mixed is constipation and diarrhea, and IBS-U, unclassified, doesn't really fit into any of those categories. Next slide, please. Thank you. So what are the treatment options for IBS? So it varies. Again, could be a combination of these, could be just one of these, but medications often used are antispasmodics, laxatives, antidiarrheal agents, antibiotics, antidepressants, etc. Supplements that are often used in IBS are probiotics, prebiotics, fiber supplements, especially if there's constipation or diarrhea going on, peppermint oil, and sometimes digestive enzymes. Stress management is a big part just because of that gut-brain connection. So cognitive behavioral therapy, gut-directed hypnotherapy is a new and evolving one, meditation, etc. Lifestyle modifications like exercise and sleep, and then of course, diet. Next slide, please. So diet and nutrition therapies are a big part of managing and treating IBS. So the low FODMAP diet is something that you may have heard of when talked about in relation to IBS. It is the most supported by research. It's basically an elimination diet and then reintroduction of the foods that you have eliminated to figure out, what potentially is a trigger food for you. Low and high fiber diets are often used, gluten-free diets, alcohol elimination, caffeine elimination, restricting fat, and restricting spicy food. So again, lots of these things are kind of employed, but the low FODMAP diet really stands out in the literature. Next slide, please. And then CDHF's My IBS app, that's an important tool. It's a free and easy to use tracking app for clients or patients with IBS. And it basically allows you to digitally journal your symptoms, your bowel movements, your pain, food, sleep, stress, etc., and kind of help you better understand and manage your IBS. It walks you through top treatment options for IBS. So that may include, the low FODMAP diet, stress management, improving sleep, increasing exercise. And within each treatment plan, the app provides information on, what the treatments entail, strategies for implementing them, and what to expect when you're on the plan. And then after tracking for at least 5 days, the My IBS app will present reports to you basically that help you kind of understand your symptoms, understand connections between the symptoms and your treatment plan. And then you can print reports to share with your doctor or your dietitian, etc. So that brings me to the end of my part. Nicole, turning on to you.
I think there's just one last slide.
Oh, my bad. Yes, so this Venn diagram will show us the similarities and the differences between IBS and celiac disease. So IBS, feeling of incomplete evacuation, mucus in the stool, bloating, abdominal pain, diarrhea, constipation, gas, lactose intolerance, and nausea. And then celiac disease will have those symptoms in the middle section there, in addition to damage to the digestive tract, as well as vomiting. All
right. Okay, so let's chat a little bit about celiac disease. So, first of all, before we move on to celiac disease, for those of you who might have think that you have IBS or have been told that you have IBS, we do always recommend that you get screened for celiac disease in order to ensure that the problem is IBS and it's not celiac disease. I often to my clients describe celiac disease as part of a foundation of the house. Celiac disease, as we will learn, affects the villi in your gut. And if your villi is damaged or atrophied, as you can see in these images, you won't be absorbing your nutrition, which causes a host of consequences, again, which we'll discuss as the presentation continues. If we don't test and rule celiac disease out, and you move forward with an IBS diagnosis without knowing if you have celiac disease, you may not be getting the most appropriate treatment plan and continue to be sick for a long period of time. So the current recommendation is, if you think you have IBS, always be screened for celiac disease in order to ensure you have an accurate diagnosis. Okay, so what is celiac disease? So celiac disease, many people think it's a form of a food allergy. It is not a food allergy, but rather it is an autoimmune disease where the immune system reacts to the protein gluten. Gluten is found in wheat, rye, barley, oats, and regular oats and their crossbred grains. And gluten is very plentiful in our food source and our food industry. And if you need to avoid it because of a diagnosis of celiac disease, this requires a support from a knowledgeable dietitian or a larger community like Celiac Canada. On this next slide, we get a better look at the damage that is caused by celiac disease to the lining of your gut. So as you saw in the previous slide, the healthy villi on the left, which has the long finger-like projections. So if you picture the nutrition being absorbed or the nutrients being absorbed in all of this surface area, when you have celiac disease, it gets blunted down and we no longer have that large surface area to absorb nutrients. This leads to, of course, micronutrient deficiencies. So as you can see on the left-hand side, we have a healthy gut progressing along in a celiac diagnosis to that flattened villi, which, as I mentioned, has a decreased absorptive capacity, leading to long-term complications of celiac disease. So we want to make sure that we diagnose early to prevent you from being sick for too long. Celiac disease is a genetic predisposed autoimmune disease. So it is more common in families where there's a history of this condition. If you have a blood relative with celiac disease, that means you're at increased risk for developing it also. For those with biopsy-diagnosed celiac disease, the current recommendation is for all first-degree relatives, regardless of symptoms, to be tested for celiac disease. So this includes siblings, children, and parents. For second-degree relatives, the recommendation is to be tested if symptoms are present. The genes that are present for celiac disease are HLA-DQ2 and HLA-DQ8. You can have genetic testing done to discover if you have one or both of these genes. And by carrying these genes, it only means that you're at risk for developing celiac disease. By discovering that you have the genes is not a confirmative diagnosis of celiac disease, but rather a possibility that you could develop it later in life or sooner. A positive genetic screen means you could have celiac disease, but a negative screen virtually rules out the possibility of celiac disease as an option. Celiac disease then comes with classic symptoms or typical symptoms and non-classic symptoms or atypical symptoms. Classic symptoms, they vary. Symptoms in general for celiac disease vary widely, and people may have multiple symptoms or singular symptoms. If you have celiac disease, you may have digestive problems or other symptoms. Those with classic symptoms of celiac disease tend to be those who are diagnosed first. Classic symptoms include abdominal distension, pain, diarrhea, weight loss, irritability, muscle wasting, or dermatitis or piriformis, which is celiac disease of the skin. Then we have non-classic or atypical symptoms of celiac disease, and those presenting with these atypical symptoms tend to be diagnosed later because we often think that there's something else going on and we're treating it. But again, thinking about that foundation of a house, if it's not strong, we're not going to be able to fix anything on top of it without it continuing to show the symptoms. So the majority of patients being diagnosed nowadays actually have non-classic symptoms, although those who are most diagnosed are those presenting with the classic symptoms, because that's what is more triggered in our medical system to look for. So some atypical symptoms include unexplained iron deficiency anemia, and in fact, 68% of those newly diagnosed with celiac disease are iron deficient. And again, that's because the villi are blunted and the absorptive capacity is reduced. Other symptoms of atypical presentations include oral canker sores, dental enamel defects, which is often the only presentation we see in our pediatric population, persistent vomiting, IBS, chronic constipation, abnormal liver enzymes, arthritis, osteoporosis, short stature in our children, delayed puberty in our pediatrics as well, and infertility. As you can see, the atypical symptoms they vary greatly, and it is very easy for them to be missed. Then we have a category of neurological complications in celiac disease. These are often the last thing that people will catch because they're not often recognized as a symptom of celiac disease. So we have symptoms like ataxia or balance issues, peripheral neuropathy, fatigue, brain fog, depression or anxiety, headaches or migraines, and dizziness. These are all neurological complications related with celiac disease. When my husband was diagnosed with celiac disease, his presentation was dizziness and brain fog. And to this day, his symptoms when he's glutened are also dizziness and brain fog. If you would like to learn more about neurological complications and celiac disease, last webinar Wednesdays for May Awareness Month in 2022, we spoke to Dr. Ian Kroll, and he is a neuroscientist from Sheffield University in England, and he gave us a really fascinating hour of information on neurological complications, and you can find that webinar on Celiac Canada's YouTube channel. Research shows us that on average, it takes 10 years for somebody to be diagnosed with celiac disease. So this leads us into the challenges of diagnosis. 85% of Canadians who have celiac disease are unaware that they have celiac disease because it is so underdiagnosed. In 2021, a study of 16,776 people, it was discovered that there was no significant difference in abdominal pain or reported symptoms between two groups of people, one with celiac disease and one without celiac disease. This same study found that of those with celiac disease, 97% of them did not know that they had this diagnosis. This brings that previously thought 85% up to a 97% undiagnosis rate. Which brings us to our next slide. This is a symptom checklist that exists on our website, Celiac Canada's website, which is www.celiac.ca. And here, if you open it up, it will give you a list of things you can check off the box, press enter, and you'll get an email to your inbox letting you know whether or not you should reach out to your physician to get screened for celiac disease. It's a very, very handy tool, and I really suggest that you do go and check it out, because again, if we miss a diagnosis, then we're not going to be able to appropriately treat whatever symptoms or problems that you're having. So how do you get diagnosed with celiac disease here in Canada? So diagnosis for celiac disease takes place in two parts. Firstly, you have to be screened with a highly effective blood test, and this is known as IgA tissue transglutaminase, or TTG antibody for short. Patients getting the blood test must be on a regular gluten-containing diet at the time of testing to ensure that the results are valid. And I need to make sure that I really ring that home, and everybody hears that. If you are already on a gluten-free diet and you get screened for celiac disease, it may come back negative, and that will be a false negative because there's no gluten protein in the body to trigger that test. Okay, so you have to be on a gluten-containing diet in order for that to be reliable. If the blood test comes back positive, then you will go on to have an endoscopy done, and that is done by a gastroenterologist, and they will take a biopsy of your small intestine in the duodenum, and then test it to see if they can see any of that atrophy in the villi. So they're going to take a really close look to see if you do in fact have celiac disease. In Canada, a biopsy diagnosis is the only way to truly diagnose celiac disease. For children under 10 years of age, there's some European standards or SFGAN standards that if their blood is showing 10 times the normal tissue transglutaminase levels, and they have a positive EMA or endomysial antibody test, then they can also be diagnosed with celiac disease. These regulations have been started to be adopted here in Canada, partially because we have extremely long wait lists for biopsies. And for our pediatric population, we want to ensure maximum growth during the time when they're having their pubertal growth spurt. So we don't want kids to be, because you noted earlier, one of the long-term complications is short stature. So we want to prevent children from having that short stature or their height affected by lack of diagnosis. So that's one of the reasons we've gone in the direction of adopting that non-biopsy approach for children. For adults, the biopsy is important. And you might ask the question, why do I need to be diagnosed with celiac disease? Why is it important? If I go on a gluten-free diet and I feel better, isn't that what matters most? And yes, absolutely, that is what matters the most. However, without an official diagnosis, you may not have all your doors open for future options or opportunities. And by that, I'm meaning tax credits here in Canada. So you are eligible for an incremental tax benefit. Celiac Canada is looking at revamping that, but currently you need to have a biopsy diagnosed celiac disease in order to you'd be able to write off the difference between the cost of a gluten-containing item for the cost of a gluten-free item. Secondly, if you don't have that official diagnosis, it might restrict your ability to access medications in the future. There are lots of different trials that are currently undergoing that are very promising. So currently what we're looking at is treatment for being gluten. So as we know, there's no current treatment for celiac disease other than the gluten-free diet. There's no medications that are currently available for our population. So the first step is if you go to a restaurant and you get cross-contaminated and you get glutened and you feel sick, that's what they're looking at medications for right now to help alleviate that distress and discomfort or symptoms at that time. So very important in order to get the accurate diagnosis to have tax credits and ensure that you are eligible for medications in the future. So what happens if I go undiagnosed? I've talked about the foundation of the house and how, nothing is going to be built strong and properly without that healthy gut. Long-term complications of celiac disease can feel scary for people. So we want to make sure those micronutrient deficiencies don't happen in unexplained infertilities, anemias, certain types of cancers, bone loss, and many others. So we want to make sure that you are being accurately diagnosed for you to have optimal health. If you are concerned that celiac disease may be a possibility for you, I encourage you to go to your physician, make an appointment, go to your physician and ask to be screened. Sometimes it's not even asking, do you think this might be a possibility, but rather saying, I attended a webinar where a dietitian from Celiac Canada was giving a description of celiac disease, and I really think I fit that bill. Do you mind if I'm screened? And currently in all provinces and territories in Canada, that initial screen is covered. So it should not cost you out of pocket. In most provinces other than Ontario, the follow-up screens year to year are also covered. Here in BC, we get, your annual screen is covered. In Ontario, unfortunately, at this time, it isn't, but we hope in the future, we might get there. So I'm going to pass it back to Nishaat, and she's going to tell you a little bit about Nutriprocan.
Thanks, Nicole. So just a little bit of background on Nutriprocan. So we are a company specialized in nutrition counseling and consulting. Most of our clients are individuals, but we do work with organizations such as workplaces, senior care, etc. And we really aim to be that one-stop shop for nutrition services with our team of dietitians and their wide areas of expertise. And our services are available virtually in Ontario, British Columbia, and Alberta. So if you want to set up a consult with one of our dietitians or you have any questions, please feel free to reach out anytime. Thank you.
Excellent. Okay, so that takes us to the end. And I would like to, it would be amiss for me not to wish Celiac Canada a happy 50th birthday. So this year, Celiac Canada is celebrating its 50th birthday. So for more information on that, or to make a donation to Celiac Canada, we are a registered charity. And so we do, we rely on donations to keep going with all of our hard work. So please visit www.celiac.ca to check out everything that we have to offer and to make a donation to us for the events like we host tonight. So I'm going to stop my screen sharing and we are going to start answering some of your questions. All right, so I will read them out and then we'll see. Okay. All right, so Joanne asks, I'm allergic to peppermint and basil. Are there any other new things out there? I found a strict GF and low FODMAP diet. I'm on a strict GF and low FODMAP diet, but still getting symptoms. So Joanne, I guess my question would be, I'm assuming you have IBS and not celiac disease. Is that correct? So let's, Nishaat, shall I pass it to you? And let's assume that she's got IBS.
Sure. Thanks for your question, Joanne. So I would say that it really depends what your symptoms are. Like, what is the main symptom that is bothering you? What's the most kind of severe and frequent symptom? And then based on that, we would then decide what kind of supplement is the most appropriate for you. So, something like peppermint oil, the research for that is really behind like cramping and stomach pain and bloating and gas. And so depends what your symptoms are. But, some other kind of supplements that are being investigated for the same purposes are, licorice root, probiotics, prebiotics. So again, it really depends what the main concern is. Joanne says, I am celiac and have IBS. Yeah.
Oh, okay.
Yeah. So, and then Joanne, I would also say that depending on kind of the supplements that you are taking, just to make sure that those are gluten-free, because a lot of supplements also contain gluten. And so just to be careful in that area.
Yeah. So just read that label and ensure that there's no gluten-containing ingredients or contains or may contain statement on there. Holly asks, what oats can people with celiac disease eat? Do all oats have gluten? So Holly, that's a great question. And oats is a really hot topic in our community. So oats, although they're inherently gluten-free themselves, they're highly cross-contaminated from field to table, essentially. So here in Canada, we're one of the largest oat producers in the world. And oats, as you can imagine, on the prairies rotates in crop with barley and wheat. And so when that happens, there's often rogue grains that are sprouted up in amongst the oat crop, and that ends up into our food source. And also a lot of machinery is being shared in the processing of oats to be put into packages. So because of that, in Canada, oats are considered a gluten-containing product. And when we're looking at our brow ingredients, so that's the acronym for barley, rye, oats, and wheat, and that is where gluten is found. So oats are considered a gluten source in Canada. However, that being said, you can buy gluten-free oats in Canada, and they come in two forms. One is purity protocol oats, and the other is mechanically optically sorted. And they will be listed in the ingredients list as gluten-free oats, and there will also be a gluten-free claim on that package. For oats to be safe, they have to be both of those. So labeling regulations state the gluten-free claim has to be there, as well as it has to be listed as gluten-free oats in the ingredients list. If it's not, then that's a labeling concern, and that company needs to be reported to the Canadian Food Inspection Agency to be looked at to ensure that those are gluten-free oats in the product. So I hope that answered your question, but yes, there are gluten-free oats available. Anonymous attendee asks, can celiac disease develop over time? Example, middle age. So I love this question because I love to give the example of the oldest person ever diagnosed with celiac disease was an Italian lady, and she was 101 years old, and she refused to go on the gluten-free diet. So yes, celiac disease can be developed from infancy until 101, or it can develop at any period of time. Now, the reason for that being, I always like to ask the question, why? So if you think of a genetic predisposition, you carry the gene for it. What triggers the gene? So we know that gluten will trigger the gene, but what makes you more susceptible to that? So there's environmental things. So why does that gene suddenly turn on? It can happen at any point in time in your life. So we do notice there's certain spikes at certain stages of life, but in general, yes, it can happen anytime. Holly asks again, can traditional and non-traditional symptoms of celiac disease show up years after eating a gluten-free diet, like dental enamel defects? So, assuming, Holly, I'm going to make a few assumptions here. So assuming you've been diagnosed with celiac disease, you've been on a strict gluten-free diet with a normalized TTG level. So you are coasting along as though on a very strict, and you've been healthy and well. If that is the case, it would be unusual for dental enamel defects to suddenly appear. The dental enamel defects also tend to happen more in our pediatric population. However, if you are poorly controlled celiac, if your TTG has been a bit undulating, if you've been quasi following a gluten-free diet, then most certainly both traditional and non-traditional symptoms could appear at any point in time. But we don't typically see symptoms presenting years after a really stable diagnosis. Helen asks, I was diagnosed with celiac disease over 20 years ago. I follow a strict gluten-free diet, yet have recently started to have abdominal pain and bloating again. Is it possible to develop IBS years later? So Nishaat, I'll let you tackle that one, unless you want me to start.
Yeah, I'm happy for you to start, and then I can jump.
Okay, super. Okay, so yes, the most simple answer to that question is yes. But when I put my celiac dietitian hat on, I would like to know that you have a stable TTG. So celiac disease over 20 years ago, following a strict gluten-free diet. But is there anything new? So I kind of think, okay, I become like a gluten sleuth, right? We become gluten detectives. Is there anything new that could possibly be triggering glutening, or is there a possible source of cross-contamination that is sneaking into your diet without you being aware of it? Are you dining in a new restaurant? Have your children grown a little bit older and now suddenly there's crumbs in the counters? Have you bought a new product and possibly the labeling has changed and it's no longer, excuse me, I've been talking too much today and I'm starting to lose my voice, and it's no longer a gluten-free product? I'm going to have to get a glass of water here in a sec. So what I would suggest is that you do that deep digging to find out whether or not there's a possible source of gluten cross-contamination that snuck into your diet. But it is possible to develop IBS. And I'm going to let Nishaat take that over while I get a glass of water.
No problem. Yes. So just kind of following on that same vein, I would also then ask, what else in your diet has changed? Have you started perhaps eating more FODMAPs that you weren't eating over the last few years? Have you also, stress is a huge factor with digestive symptoms. So, like I said, that can be one of kind of either the triggers of IBS or kind of keep it going. So is there, a stressful situation that's come up, or you feel under more stress at the moment, and that's maybe you're triggering some symptoms, not necessarily food? Is it a combination of both? So it is possible, yes, but it, like Nicole said, I think a little bit more of a deep dive into why it may be occurring is also valid here.
Thank you. Sorry about that, everybody. Okay, so Desiree asks, can a general surgeon perform a celiac biopsy? Not as knowledgeable as a gastroenterologist. Which do you recommend? Okay, so I'm not 100% sure about this, Desiree, to be honest, but I'm going to give it my best guess. And my best guess would be if you're in a small town and there's not access to a gastroenterologist, then it might be done by a general surgeon. But I don't 100% know the answer to that. And we can certainly dig a little deeper and find out the answer. And I can get back to you if you wanted to email me. So everybody, I'm going to put my email in the chat. Where's the chat? Why can't I find the chat on my screen? Oh, because it's being blocked there. Okay, so I'm going to put my email for everybody in the chat. So if you have any specific questions you wanted to ask me, I will put it right there. So Desiree, I can find out that for you. But if you don't mind emailing me the question, and then I can get back to you. Unless, Nishaat, do you know specifically?
Not off the top of my head. No.
Yeah. I would imagine it's always preferable that a gastro does it, but I imagine if there's a smaller town, then it might be somebody else doing it. Anne-Marie asks, is the genetic screening covered? Here in BC it is. I can't speak to other provinces on that. You'd have to ask your doctor or call the Life Labs and ask them. Frank asks, is there any connection between Crohn's disease and celiac disease? So we do know that there's an increased risk of, there's similarities, obviously, in presentation of symptoms. If you have Crohn's disease, does that put you at increased risk for developing celiac disease? Or if you have celiac disease, does that put you at increased risk for developing Crohn's disease? I don't think the answer to that is yes. I believe that the answer to that is by having one, it doesn't increase your risk of having another. So we do know, for example, people who have type 1 diabetes are at increased risk for developing celiac disease, especially within the first 5 years after diagnosis. We know that people with thyroid issues or autoimmune thyroid disease are at increased risk for developing celiac disease, and vice versa. We know that there's lots of different autoimmune diseases that predispose you to be at increased risk for celiac disease. For those with colitis, again, anybody presenting with symptoms of Crohn's or colitis should be screened for celiac disease. Anytime we're not certain of a diagnosis, we should always be screened. But I don't believe there's an increased risk for somebody with Crohn's to develop celiac disease in their lifetime. Holly asks, other than avoiding gluten, what are some good lifestyle changes to make to support gut health? And Nishaat, I'll let you answer that one.
That one, yeah, thank you. So Holly, it depends kind of if we're talking about relieving symptoms or if we're talking about just general gut health, keeping stable, staying well. If there are symptoms occurring, then it's kind of more about investigating what is causing those symptoms. Like if you're having constipation, if you're having diarrhea, if you're having bloating, is there something that, we need to work on? Like, for example, we need to reach, the level of fiber that works best for you. The recommendation is about 25 to 30 grams per day, but everyone's a little bit different. And, the level of fiber that works well for somebody with constipation is not the same as with diarrhea, is not the same as with normal stool. So I would say that good lifestyle changes would be to ensure that you're eating a well-balanced diet of enough nutrients to actually support your gut lining, to support the way that your gut is functioning, to ensure that you have enough fiber in your diet, to ensure you have the right types of fiber, to make sure that you are also, avoiding the other things that we know are not so great for our gut health, like alcohol and smoking, and managing your stress, doing your exercise. So all the typical kind of things that you would think of in terms of a healthy lifestyle. And then in addition, paying a little bit more focus to things like the gut bacteria, so probiotics, prebiotics, and then fiber. Is essentially what I would say. But again, that's kind of a general answer. It really depends what's going on individually.
So Nishaat, I'll let you take this next one as well. Can probiotics cause or worsen constipation?
Yes, very interesting question. I would say yes. With probiotics, it's kind of hard to say if it's a cause or if it's a worsening, because there's always, there's so much else going on in the gut typically, but there are certain probiotics that are specifically for constipation, specific probiotics that are specifically for infectious diarrhea, specific probiotics that are for IBS as a whole. So it really depends what you're taking. It depends what the strain, the dose, how long you're taking it for. And so it really is important to get a good quality probiotic to make sure that, what you're taking is kind of supported by the research. A really great resource that I like, and I'll put it into the chat here, is probioticchart.ca. So they have a lot of good evidence for which probiotics are appropriate for which conditions. So I would say maybe kind of
Awesome.
that. Yeah.
Awesome. I'm going to check that out as well. Okay, Stacy asks, what would constitute a gluten-free containing diet prior to screening? How much gluten would be sufficient? So Stacy, I'm going to actually direct you to our YouTube channel. And on there, you'll find a gluten challenge webinar. And what that gluten challenge will, even if you have continued to eat gluten and don't need a challenge, what it will demonstrate to you is how much gluten you have to eat in a day. And that's equivalent to about, for an adult, 1.5 pieces of bread or 3/4 cup of pasta. So it is not that much, but it is enough. So we need to make sure you're getting enough in your system to trigger that. So hopefully that is helpful. Nancy says, I have celiac disease and IBS. Can you speak to fructose intolerance?
I'm not really sure I understand that question. So fructose intolerance, it depends if that's something that you have identified through a process of either elimination and reintroduction, that you are intolerant to foods high in excess fructose, so apples, mangoes, watermelon, honey, things like that. It depends if that's what's a trigger food for your IBS or not. In relation to celiac, I'm not really sure. I'll let Nicole take that one.
Yeah, I don't believe there's an increased risk. So I don't know of any link between celiac disease and fructose intolerance. I would suspect that it would be more of an IBS sort of related issue. So no, I would say I can't speak to a connection between those two. It almost stands alone, honestly. Okay, sorry, I've got a cat who's decided to join me, as he does on all webinars. Hi, Winston. And I'm wearing my green, by the way. I'm not wearing a casual t-shirt just for the sake of it tonight. It's my celiac awareness t-shirt. So I always like to wear it in the month for my webinars throughout the month of May. Okay, so Christy asked, I've heard that Nerva app for hypnotherapy can help with IBS as well. Do you have any feedback on this? I don't. So I'm going to pass that over to you, Nishaat, because I have no idea.
I do. It's actually a very interesting up and coming way. Gut-directed hypnotherapy basically is what it is, of treating and managing IBS. There's some good research coming out about it, especially like in Australia and the UK. And they're showing around 70 to 80% symptom reduction with gut-directed hypnotherapy, like combining it with the low FODMAP diet as well. So there's some good research there. However, it is new, it is evolving, the studies are smaller. So I would say that that's probably a conversation to have with your doctor or your dietitian, whether it's appropriate for you. It's not hypnotherapy is not appropriate for everyone. It's not really something that's really being supervised. So I would say it, again, depends on the person, but it's a very interesting area of research, definitely to keep an eye on.
Interesting. That's fascinating. Okay, anonymous attendee. My GP refuses to give me an annual TTG test in BC because she says that I have celiac disease and it shouldn't matter. Do you have any advice? Okay, I do have some advice. Go to our website, celiac.ca, and print up our management page and bring that to your doctor. And on that page, it will clearly state that you should have an annual TTG test done to ensure that you are on the right track. If you are one of those people who are asymptomatic, or when you get gluten cross-contamination and you don't know it, how will we know that you are not being glutened on a regular basis unless we regularly test your TTG to ensure that you're stable? So it is very important for physicians to understand the why behind that TTG test. It's not for diagnosis at this point in time. It is a management tool, and it is to ensure, because there's gluten in our food system, so it's just everywhere, and we have to be so careful, and it's so expensive to follow a gluten-free diet. So people are often buying foods that they're like, well, I hope it's okay. The ingredients look fine, but it's hard to know, especially if you're buying from bulk bins. It's hard to know. So there's a lot of risk assessment that people are doing. So that annual test or screen is very important to best manage your own health. So your doctor, print up that piece of paper and bring it into them. But I really do encourage you to push for that. Okay, Kathy, I was diagnosed with celiac disease in 2007. I very strictly follow a gluten-free diet and follow up with a regular normal blood work yearly. I have symptoms of diarrhea and constipation regularly. Is it possible that I have IBS? Yes, absolutely. It's always possible that IBS is part of the diagnoses. You're assuming that your TTG is normal. I will say, despite a normal TTG, it doesn't mean that you're not being glutened occasionally. But if the diarrhea and constipation are chronic and your TTG is normal, then it could be something else, and it could be IBS. Do you have anything to add to that, Nishaat?
I would say kind of identifying if there's any triggers that you can figure out in terms of the constipation and diarrhea. Are certain days worse, are certain days better? Have you been able to identify, other triggers? So maybe FODMAPs, maybe fiber, maybe stress. So yes, it is possible, but investigating the bigger picture, I think, is necessary before saying it is IBS.
As outpatient dietitians, I'm sure I can speak for both of us when we say food diaries can be very helpful. So if you write down food and symptom diaries, and then you can see, because it's so hard to remember, oh, I've got diarrhea again. Did I eat that last week? Did I eat that a few days ago? But if you write it down along with your symptoms, then you can take a look over the pages and say, oh, every time I eat popcorn, I get diarrhea, or every time I eat black beans, I get diarrhea. And then you can cut that out. So really writing pen to paper and getting those symptoms and your food diary written down can be very helpful in the management of your overall condition. Okay, Marina asks, I was diagnosed with celiac disease via blood test, high reaction, but my wait for a specialist is long to 2024. I was diagnosed with IBS a long time ago and now celiac disease. I have been gluten-free since November. However, since still experiencing many symptoms, what do you suggest going forward for me in the interim? Marina, you're in a very difficult position, and I'm so sorry that our wait lists are so long here in Canada for biopsies to diagnose. So I will tell you a few things. Symptoms don't go away overnight when it comes to celiac disease. As mentioned before, the villi get damaged, then we have absorptive issues. That can also come along with symptoms and some of the various both typical and atypical symptoms. And those symptoms will improve as your gut heals. So it can take 2+ years for your gut to heal. So although we often see an improvement in symptoms almost immediately, it takes a long time for the overall, for you to be well again. Now, that's the first part of that question. The second part of that question is, I've gone gluten-free. I still need to have a biopsy. You need to be on a gluten-containing diet for that biopsy to be accurate, which means you're going to need to go on a gluten challenge before the date of your biopsy. I don't often recommend people go gluten-free before their biopsy. And the reason is I like people to have the option of putting themselves on a wait list. When my daughter was diagnosed, we were told it was going to be a 6-month wait. This goes back 7 years. And I ended up getting her in 2 months because Children's Hospital called us and said, we've got an opening next week. Can your daughter make it? And I said, yes, she can. I had kept her on a gluten-containing diet. If she had gone gluten-free, that week would not have been enough time for us to reintroduce gluten and get that biopsy done. But you've already gone gluten-free since November. So we are well into your gluten-free thing. So there's no sense in turning back now. If you have, you can wait for your biopsy, but 6 to 8 weeks before that date, you will have to do a gluten challenge. Please go to our website, not our website. Well, yes, you could go to our website, or you go to our YouTube channel, and the gluten challenge is a short 5-minute video on there, and it will walk you through it. But your symptoms might take time to heal. Okay, next question, Maria. I have IBS and celiac disease. Is it necessary to do the low FODMAP diet?
I would say it depends. Again, like is our answer with most of these questions. Are you experiencing symptoms? Are you completely gluten-free? You're gluten-free, you've checked all sources. If you're still experiencing symptoms, I think that, the low FODMAP diet is always a great tool to pull out. Just keep in mind that even for people with IBS, it works for about 80% of people. So it doesn't work for everyone. You may not actually be intolerant to FODMAPs. And it is something to do under the guidance of a dietitian, just because if not, it can be restrictive Your nutrients can be depleted if you're not replacing the things that you've cut out, etc. So I would say that it's worth a shot, but again, it depends, and I would definitely talk to a professional before starting that.
Okay, I am noticing it is 4:51 and we've got several questions left. So we're going to go into hyperspeed mode for question answering so we can get as many questions answered as possible, understanding that if some people have to leave at 5, that's fine. We might go a couple of minutes over, but we won't go much past that. So we're going to try to do this quickly. So Alicia says, my celiac disease is under control. TTG was 4 at last blood work, but still having lots of GI symptoms. The gastro did lots of tests and ultimately diagnosed me with IBS. She recommended eating 2 kiwis per day, as there is apparently research to show that kiwis help with symptoms. Have you ever heard this? Also, I really want to feel better. Is it worth me trying the low FODMAP diet? Interesting, kiwis.
I use them a lot in my practice when there's constipation. So it's something that I think is worth a shot. I think you can give it a try, 1 or 2 kiwis a day, see if it helps. If within a week or 2 it's not really making a difference, do you need to keep kiwis in your diet as medication? No. Are they a healthy fruit? Sure. So it's not a miracle cure, but I do think it's worth a shot. If you like kiwi, you don't react to it, you want to add it in, go for it.
Okay. If I understand correctly, mucus in the stool is a symptom of IBS and it's not associated with celiac disease, even during glutening. I don't know of mucus in the stool as being one of the symptoms of celiac disease. However, I can't definitively rule that out. There's so many symptoms of celiac disease, and I wouldn't say that I would be surprised if mucus in the stool could present as a symptom. So I don't think we can say that it's definitively IBS versus celiac disease. It could be either. Lori, is it possible to develop IBS many years after celiac diagnosis when the initial symptoms of celiac were non-classic, so non-GI?
I would say yes. Like we answered before, it's always possible for anyone to develop.
Always possible. Okay, Nicole Sinclair, I was diagnosed with celiac disease in 2007, and other than accidental glutening now and then, I follow a very strict gluten-free diet. Since a bad glutening over Christmas at the airport, my stomach has not recovered. I took probiotics for a month and felt a bit better, but still feel off. Is it possible to develop IBS in addition to celiac disease? I haven't spoken with my doctor. I live alone and on strict gluten-free diet. So this is coming up a lot, everybody. Can I have both celiac disease and IBS? And the answer is yes, absolutely. You can have yes. As you saw by that Venn diagram, lots of the symptoms do overlap, but we can have a dual diagnosis at the same time. So Nicole, I'm so sorry that happened at the airport. Airports can be a tricky spot. I hope you feel better soon. Okay, Layla, what are the spikes you mentioned that may rise in a lifetime where celiac disease is triggered? So we do see spikes in children when they're younger and in adults in their 20s. And then occasionally after pregnancy, we can see spikes in celiac diagnosis as well. Barbara, I was diagnosed with celiac disease 6 years ago. I'm on a strict gluten-free diet, and even though my symptoms have improved, I still get symptoms. Can you explain? I was diagnosed 6 years ago. I'm on a strict gluten-free diet, and even though my symptoms have improved, I still get symptoms. Okay, so I would have to ask, are you on have you had your TTG tested, and are we sure that you're on a strict gluten-free diet? Are we sure there's no hidden, and there are no hidden sources of gluten in Canada, however, because labeling laws don't allow for hidden gluten. However, when I use the term hidden, I mean unknown sources, some areas that maybe there's cross-contamination that you're getting gluten from. That's what I would be wondering about, because symptoms are coming from something, and they're either coming from celiac disease or possibly some other gut issue. Remember, everybody who out there who has celiac disease, not everything is celiac disease. We tend to like to scapegoat celiac disease for all of our problems, but there are other health issues that can happen. Okay, next, Joanne. I was diagnosed with celiac disease 35 years ago by a dietitian using an elimination diet. So I've been gluten-free for a long time. I can't go back to eating gluten as I was very sick. Now the blood testing is available. I haven't had any follow-up testing. What can I do to have my doctor? Okay, so Joanne, here's what you need to do. So yes, we are not going to put you on a gluten challenge. We are not going to put you through that after being gluten-free for so long and feeling well. But what you might want to do is we are going to assume you have celiac disease, and you can say to your physician, I'd like to get a TTG test to see where my tissue transglutaminase levels are at. And that should be a completely relevant question, completely appropriate question for them to follow up with. Depending on what province you're in, the first one in Ontario would be free, but thereafter it wouldn't be. So just keep that in mind, but otherwise I would get one done and find out where you're at. Renea, I'm celiac since 12 years old or ago, and I never tested again knowing that I'm 100% gluten-free. Is that okay? No, well, yes, it is okay if that's your choice. However, our current recommendation is to have that management and get that test done yearly to ensure you are on a right track. My partner is newly diagnosed with celiac disease. Would they need to get their test? Yes. So this is another management question. I'm seeing a lot of trends in our questions here. Yes. So newly diagnosed, we should get screened, and then at the 6 month and then the year mark, and then every year thereafter. Shayla, how can I address chronic diarrhea that I experience with celiac disease? I love fibrous foods because they are healthier, but as you can guess, contributes to diarrhea. I have reduced the fiber amounts per serving. Okay, so Shayla, I might actually suggest that you switch the type of fiber and maybe introduce a Metamucil or a soluble fiber into your diet, because that will actually help to reduce the diarrhea. We will put people on Metamucil therapeutically to help reduce diarrhea in my outpatient chronic disease management position. So yeah, that can help. I would also suggest that you get your TTG tested just to make sure that you're not consistently glutening yourself with some unknown source in your household. Do you have anything else to add to that?
No, I think you covered that type of fiber, yeah, and the amounts.
Yeah. Don't be afraid of fiber. Sometimes it can help. How do I know I have IBS when I have been diagnosed with celiac disease? Are the symptoms very similar, and can testing be done to confirm?
This is something a doctor would have to diagnose. Like, it's not something I recommend trying to self-diagnose. So that's something to go back to your doctor and say, hey, I'm still having these symptoms. Is it possible I also have IBS? And then they would do the investigations.
Yeah. I have celiac disease and I'm lactose intolerant. I have constipation, cannot completely empty my bowels when they go in the bathroom. What would be the best thing for this? So, Michelle, so when you are first diagnosed with celiac disease, people are often lactose intolerant. Lactase enzyme lives on the end of the villi, and when it's blunted off, a lot of people have issues. When your gut has healed, quite often people will be able to digest lactose again. So hold tight, because you might be able to digest lactose if you are newly diagnosed. If not, and constipation is an issue, then we would get you on a high. Sorry, my cat just stepped on the on my keyboard, and I was worried he would shut down the whole thing. Okay, my apologies. What we would do is, in order to treat constipation, we need to get you on a higher fiber diet, drinking lots of fluids, moving your body. There's lots of stuff that we can do for constipation. And there actually is a short email. Sorry, this cat is distracting me because I don't want him to come near the keyboard again. There is a short video on our YouTube channel on celiac disease and fiber and how to increase it and where to find it. So I encourage you to go and check out our YouTube channel. What probiotics do you recommend? So Nishaat did put a link to that in our chat. So anonymous attendee, I encourage you to take a look at that link, and it will be helpful. I'm going to check out that link. What are good exercises to do when you have IBS? I find doing exercises too hardcore make me feel constipated, bloated, and I don't feel good.
Great question. So the CDHF website, they actually have a whole combination of exercises for digestive health. I would recommend going on there. They have really interesting poses, mostly yoga poses and stretches to kind of help relieve things like trapped gas, stomach pain, bloating. So I would definitely recommend checking that out. It's really easy to follow.
So I'm just going to cut and paste or copy and paste this so everybody sees that. There's the link Lana was asking. Okay. In retrospect, I believe I've had celiac disease my whole life, but only diagnosed, thankfully, finally in my 70s with a total gluten-free diet since diagnosis. I still have IBS symptoms. Question, is it lifelong? So Gladys, I'm so sorry you suffered for so long with celiac disease, but I'm so glad you were finally diagnosed. IBS, is it a lifelong condition?
Yes and no. There's flares up and down. It's not like celiac where you have to be super strict with what you're eating forever. But IBS is kind of one of those chronic conditions that flares up, and then there's periods, it could be years of no symptoms, and then could flare up again. So yes and no. Yeah.
Eileen has a great question about her 11-year-old daughter who is very scared of needles, and they're wondering if there's any risk or benefit to just having her go on a strict gluten-free diet since her mom is already confirmed celiac. So Eileen, I hate to be the bearer of bad news, but I really would encourage you to get your 11-year-old screened and tested properly in order to open the doors for her to ensure she has access to medications when they become available. Remember, medications are being tested on biopsy diagnosed people with celiac disease. And in order for your daughter to get them covered and have access, she needs to also have biopsy diagnosed celiac disease. She's 11, so she doesn't qualify for the ESPGHAN standards of the 10 and under being 10 times the normal TTG. We want to make sure for our young ones that we do the due diligence now and get the testing done properly. I've got 3 children and I understand the fear of needles. Here's where we need to just be very creative in how we can best support your daughter in being comfortable and accepting of getting the blood work done. But I really do think that it's important that because there will be medication available in her lifetime. I can almost guarantee it, and we want to make sure she can access it. JL, is it possible once you were diagnosed with celiac disease that later in life you would not be celiac anymore? No, unfortunately, JL, that is an old wives' tale. Celiac disease will never go away. It is an autoimmune condition that you have for life. If somebody says they had it and they don't have it anymore, they never had celiac disease in the first place. It is a lifelong condition. Okay, we're 5:03, so let's just do maybe 3 more questions. Lactose cultured or flour-based supplements aggravate my IBS. Are there any pre or probiotics that I can take?
There are some vegan supplements out there. Again, a lot of people with lactose intolerance are actually okay with taking the lactose cultured supplements. It's very individual. I would say that that's something that needs a little bit more of a deep dive before I can make a recommendation. So that would be something maybe a little bit more to kind of go over that website or to speak to a dietitian who can kind of look over your symptoms, look over your dietary history and all of that and give you a better answer.
Okay, I'm just typing a few things. Nishaat, do you want to actually read one more question?
Sure.
And I'm just going to type away at a few of these to try and help people.
Sure. So I think a lot of these are celiac based questions. Nicole.
Oh, okay. Sorry, that's not going to be helpful then. I
Okay.
just wanted somebody was asking about the disability and tax credits. So I want to make sure that everybody knows where to email for that. So we actually do have an email and it is CCA tax, just typing it in here, QA@celiac.ca. And that is Linda Nielsen on the other end of that email. And she is a genius when it comes to answering these questions. I will type it in the chat here too. CCA tax QA@celiac.ca. There it is there in the chat for everybody to check a look at. Metamucil is gluten-free. Probiotics not being regulated. They are, if they're in Canada, and they've got French and English on the label, they have to be under the natural health product regulations, they have to be. Can you address issues with dermatitis herpetiformis? Jennifer, I would love to. It's a whole other conversation. It's a whole other webinar. I encourage you to go to celiac.ca, check out their whole page on DH and their YouTube channel. There's information on DH. DH is treated exactly the same way as celiac diseases, except occasionally often there's a medication dapsone that is included in the treatment plan to help with the itching and to take away the rash. It is something that we need to do more work on, agreed. A lot of people have the atypical symptoms, Emma. Lots of people do. I don't have a percentage on the top of my head, but many do. How do you find a dietitian who's knowledgeable with celiac disease and IBS? Well, for the IBS, Nishaat works with Nutriprocan, and so they've got their website, and you can check out and you can reach out to Nishaat personally. For celiac disease, I encourage you to look on Dietitians of Canada website, and there you can find a dietitian who's knowledgeable in celiac disease. If you're in BC and you're looking for a private dietitian, I'm happy to talk to you. If you're looking for general information, we have a phone number that you can call. And I don't know it off the top of my head, but I'm going to give it to you because it's extremely important, because it's free and you can access it. And it's our peer supporters who will answer their question. And if you then need to speak to a dietitian from there, you can do so. But let me just get that number for you. 1-800-363-7296. 1-800-363-7296. And there you can ask any questions. Okay, I think that's all we have time for. I'm so sorry, everybody, that we don't have time for any more questions, but I've got to go. I coach my daughter's field hockey team, and it's after 5 and it starts in 15 minutes. So I better go. But please do connect with me via email. Ask Linda anything at that CCA tax. Give us a phone call. We're always here to support you. The CCA has been here for 50 years. I hope we'll be here for 50 years more to help support you with all your questions. And for the CDHF, if you have questions about IBS, check out their website. And of course, Nishaat is there with Nutriprocan. So thank you, everybody, so much for joining us tonight. We have another webinar next week, Webinar Wednesday, with Dr. Ben Lebwal, who's a gastroenterologist from Columbia University, and he is an absolute genius, and he is a thrill to listen to speak. So if you want to ask a gastroenterologist questions, when else do you get an opportunity to ask a gastroenterologist any questions? He will be here answering our questions after he gives us the latest updates on celiac disease. Please sign up for that, and I hope to see you there. Thanks so much, everybody, for joining us tonight from North Vancouver. I'll say bye-bye.
Thanks, everyone. Have a great night.
Thanks so much, Nishaat, for joining me.
Bye-bye.
Bye-bye.
Bye.